Now anesthesia is not an end branch, there is an upgrade.
What all factors help you to choose anesthesia?
Postings, all the subspecialties and super specialties at least twice.
So what are the future prospects of the branch? Hi guys, welcome to Usmania Docs. Today we have Dr.Soumya. She is a third year resident of anesthesia and she recently wrote her theory exams, and glad we have a lot of questions and we have to know what all things are happening in her department, and she will guide us through the residency program in NIMS Hospital in Department of Anesthesia. Okay, thank you for joining us. So how did you choose the branch? What all factors help you to choose anesthesia?
Right from my MBBS, I didn't have anything on my mind. But after PG preparation, I only had two options on my mind. One is gynoms and the second one is anesthesia.
Okay.
Gynoms because I am very passionate towards it.
Okay.
And anesthesia because I have accuracy, speed and some talents regarding anesthesia. And also I thought anesthesia, work-life balance will be good. So I have only taken two choices and
Okay.
I got anesthesia here.
Okay. So you preferred, you had two in mind, so you preferred anesthesia.
Yeah.
Okay. Okay. And like you had any introspection in your internship, like anesthesia, these all sort of work you have that did help you to pick the branch, like?
Yeah, we have seen that anesthesia is a good branch.
Okay.
In Usmania, we had posting for 15 days in anesthesia.
Okay. So you got some insights there.
Yeah.
So what the work culture there, or else what all things you have to do as an anesthetist you come across in internship?
Yeah.
So that helped you. Okay, then how many seats are there in NIMS in your?
In NIMS, we have 4 batches total: JR1, 2, 3, and SR. In every batch, we have 21 residents.
21.
Yes, a total of 84 residents. And if at all requirement is there, they will take non-academic SRs also.
Okay, okay. So you have a big team to to work and to accommodate. So how is the postings? Like in first year, where are you posted? Second year, third year?
In first year, there is no such division, sir.
Okay.
The postings will be divided equally in each year.
Okay.
At least one posting we will get in a year. Like in 3 years, we'll get all the 3 postings, all the subspecialties and super specialties at least twice.
Okay.
Okay.
In 3 years, you mean to say all subspecialties and super specialties will be rotated twice?
Twice, right.
So subspecialties like?
Subspecialties like cardiothoracic surgery, vascular surgery, neurosurgery, surgical gastroenterology, surgical oncology, urology, plastic surgery. All these we will rotate, sir.
Okay.
And in subspecialties, we have.
These are all super specialties.
Right.
Rotation.
Right.
Okay. Subspecialties.
We have ortho. Orthopedics.
It's like broad specialty branches.
Yeah. We also have 2 ICUs here, RICU and ACCU, that are closed ICUs for anesthesia department.
Okay.
Right.
So for gynops and pediatrics?
For gynops, we have to go to Usmania, sir.
Okay.
We'll be posted in MGMH.
Okay.
There we'll be posted for 3 months.
Okay.
And additionally, we'll get 3 months DRP where most of the cases are gynops only.
Gynops. So,
and and for pediatrics, we'll go for Nilofer. We'll have 1 month posting.
Okay.
For ENT Ofta, we'll go for again Usmania.
Sarojini Devi
and ENT Government Hospital.
Okay.
15 days each. And for gynops, we also have additionally, we'll go to Fernandez for 15 days. Just to see how non-LSCS. Most of the techniques there are epidural analgesias and all.
Okay.
That non-pharmacological therapy of handling the pain of visual pain and somatic pain of the labor. All these things will be dealt in Fernandez posting, which will be like 15 days.
15 days. So more or less in your curriculum in a 3 years period, you have a good exposure of all broad specialties.
Yes.
And almost more exposure of super specialties.
Right.
I mean, when you compare with other like different medical colleges, where I feel that the super specialty exposure is more in NIMS. Is that so?
Yes.
Okay. So you will be like exposed to more of cardiac anesthesia, cardiothoracic anesthesia, neuro anesthesia.
Right. At least 2 months, 2 whole months will be posted there.
Okay.
And if at all we ask for a posting or we take thesis in the thesis as that subject, then we'll be posted for 4 months.
Okay. So more.
So it's an advantage.
Okay. So overall, does this help you in picking up your super specialties? Because nowadays even anesthesia, people are like most of anesthesia are going for super specialties. Can you elaborate like how that would be helpful?
Sir, now anesthesia is not an N branch. We got a few super
Upgrade.
specialties. Yeah, there is
Okay.
an upgrade. So we have cardiac anesthesia, we have neuro anesthesia,
Okay.
we have CCM again,
Okay.
we have transplant anesthesia, onco anesthesia.
Okay.
So the branch is evolving. It's not a dead end.
Okay.
So when we work here with the different super specialties and subspecialties,
Yeah.
so we know what our interest is. We
Okay,
can
you will get
actually
exposure.
explore what our interest is,
Yeah.
and we can further proceed with the career options.
Yeah, yeah. So once you get hands-on and you will share the work, then it will be easy for you to pick what exactly super specialty you want.
Yeah.
So okay, and it's very good thing. And coming to your academics and like thesis topic.
Actually, the academics are a little less. Like classes, the duration of classes is little less compared to other colleges
Okay.
in our state. We have Tuesday and Saturday 8 to 9 morning 9 a.m. class,
Okay.
and our juniors like first year residents, they have 2:30 to 3:30 p.m. Thursday class also.
Okay.
They have 3 classes, we have 2 classes.
Okay.
But the academics, like we go to conferences and they will put few workshops like novice here itself.
Okay. So,
For the orientation and all.
okay.
And academic wise, we will have to teach also, sir, because here we have technicians.
Okay.
So under us, so we have to teach the technicians. Like every week we'll get 1 class, 1 hour class. So whatever we are taking, we have to give through.
Okay.
So that's a nice learning process and that's nice flow.
So you learn through seniors and you even share your knowledge through
Yes.
To next gen like technicians and these people. So it's like more or less a strong academic curriculum.
Right.
Even you have exposure for conferences and which I think happen more frequently here.
Yeah.
So you have more exposure for those things also.
Yeah, we also have a simulation lab which exposes ourselves. Like in first year,
Okay.
they will give us the hands-on in the simulation itself.
So that's like you will like seeing all these things. What is the hands-on like?
Hands-on is good, sir. Right from the first year, they will give us hands-on.
Okay.
They will start giving IV lines, epidurals, central lines. And in the second year and third year, we will go more of ultrasound procedures.
Okay.
And in second year, we'll have to work for theses and all.
Okay.
So hands-on is really good.
Okay. Because they think that in broad specialties, like more assistant professors and like SRs, very strong, like strong people are there. So the like hands-on are less usually because in surgeries departments it happens like that. But I think as a lot of departments, the work is lot, so you get a lot of hands-on.
Yeah.
Okay, very good. And coming to stipends, like payment.
Sir, NIMS is a state act college, so there is no stipend in NIMS. It is
Okay.
called salary.
Oh, you get salary.
Yeah.
Okay.
We are considered employees and we get salary. It's like 56,100 is the basic pay.
Okay.
And we get allowances.
Okay.
The total reaching like 1 to 1.15 lakh. In the first year, we'll get around 90 and it gradually increases based on the allowances.
So
To 1 lakh is minimum. Minimum that we get.
Okay.
And there will be tax deductions also because it is considered salary. But
so around you get like 90 to 1.15.
1.15.
1.15
Yeah.
like that. Okay. But timely payment?
Yes. Every month on first, we'll get our payment right in our bank accounts.
Okay.
Unless it is a holiday.
Okay. So that's a very good thing in residency.
Yeah.
So how are the night duties scheduled? How many duties you get? How hectic are the duties?
So we have 4 to 5 night duties per month.
Per month, okay.
Yeah. And it is hectic, definitely, because of the caseload and all.
Okay.
It is an apex hospital, so the caseload will be very high.
Okay.
And there are many super specialties, so we don't know what kind of surgery we need to attend to.
Okay.
So the duty will be definitely hectic, but we get post duty offs. That is the advantage.
Oh.
And the number of duties also compared to other places, it is low.
I
like
thought
4
first
to 5.
4 to 5 when you said, I thought week
Per week. No, sir.
4 to 5 in a month, I think like
Yeah.
that's a cool thing.
Negotiable.
And you get post duty off also.
Yeah.
That's more pleasant thing to hear.
Yeah.
So it's a very good thing. So once you pass, once you people pass, how are your seniors performing? Like, are they getting into corporate, or they are starting their own ICUs, or attaching to a hospital? Like, like are they going for more of super specialties? Can you elaborate?
Most of my seniors have gone to corporate sector, and some of them have gone to upgradation into super specialty branches.
Okay.
But I think there are many options.
Okay.
You can go into government sector, you can go into private sector, then you can go into corporate sector. Okay. There is a lot of scope for anesthesia. Everywhere there is need.
Need.
So need is so high. Just imagine, just our hospital has 21 residents
Yeah.
per batch. It
Still
means
you are saying lot of need, because
Yes.
many places what happens, as a seat load increases, they feel competition ज़्यादा हो रहा है, and survival things, all these things come. So you are saying so many seats are there, still there is a lot of need.
yeah, this branch is also evolving, sir,
Okay.
and it also has a lot of scope because there is a lot of need, and anesthesia is evolving because the surgeries are growing also
So
in all the branches.
okay, the complicated surgery is evolving.
Yeah.
The unresectable things are being resected because of technological advancement.
Right.
So you need anesthesia support for all those things.
Right.
And as such, also you are the technological upgrade on your side also propels you to handle more things. So you need more people to do all these things. So okay, it's a great thing to listen about the anesthesia department. Can you give what is a good advice for our audience about your branch and as well as your NIMS hospital?
Okay. Every branch has its own pros and cons, and anesthesia has its own pros and cons. In anesthesia, you have wide variety of options. You can do night duties just as you wanted. Only you can do day duties, or you can do scheduled duties as you wanted. You can do freelancing. You can work in 5 to 6 different hospitals. You can work in a government sector where your leadership you can enable your leadership goals also, and at the same time it has a backdraws also, because anesthesia is a dependent branch. You cannot survive alone. You need surgical branches to cope up or work with. You should have good interpersonal relationship skills to survive in the surgical branches along with them. And patient recognition will not be there at all. Nobody really praises an anesthetist, even though a lot of work goes into the patient care. Nobody recognizes that the face that which patients see is a surgeon's face. So you might not feel satisfied at all. That is the drawback. And coming to NIMS has its own pros and cons. The salary is good. The academics are good. High-end equipment is there. Good teaching staff. The knowledge that you want to acquire, everything is like in loads of amount, and it will be very sufficient to your future whatever career options that you're choosing. And coming to the cons, you have long working hours. The working hours were very hectic, and this is a high-end hospital, so you have high-end equipment. It is an advantage, but at the same time it is a drawback also, because when you go to outside hospitals and work in a government or private sector, you may not see these much equipment. You will have to work with a minimal equipments and all. All these things are available only at corporate hospitals, so many people are joining in corporate sectors. So everything has its own pros and cons, I believe. But anesthesia is a good branch. You can opt for it.
Okay, guys, thank you very much for your appreciation of videos and all the comments. I hope this video has helped you a lot. Please comment for more content or which branches you want in next videos. Thank you for staying with us. Please share and subscribe. Thank you very much.
Please like, share, and subscribe.